Hey everybody, Dr. Rob Silverman here, Amazon best-selling author, Inside Out Health. I hope everybody had a great weekend, getting outside, moving around, enjoying the beautiful landscape. Today I'm going to be answering your questions. We have a whole bunch that we received last week that I wasn't able to get to, so I'm going to answer them live. If anybody has a question, please feel free to put it in the chat box on any of your threads, and I'm going to answer all your different questions. So somebody's going to punch a question up, and when they do, I'm going to press show. Everybody's going to see it, and I'm going to give you my answers. I love this opportunity to share how I feel, and I love the opportunity to communicate with everybody in a Q&A format to start the week off. So once again, anybody who has any questions, feel free. And let's start it off. Is question number one. Are all fats equally good for gut health? Great question. So everybody knows that I'm a proponent of minimizing the consumption of carbohydrates, especially man-made carbohydrates. Man-made carbohydrates, high in sugar, really not nutritionally dense, just calorically high. With all that being said, the real issue or the suggestion is fats are a better choice than carbohydrates. You always want to avoid trans fats. So trans fats are no bueno, they're not healthy for you. So we don't want any trans fats. The other thing is the studies have shown that mono and polyunsaturated fats have a fabulous effect on health promoting in your gut. But when you look at the saturated fat is fine, but a large number or eating a lot of saturated fat, too much coconut is very damaging because it damages the gut in that it releases LPS, which is an endotoxin, leads you down a path of endotoxemia. So if I was everybody there, I would, without question, I would not eat a high amount of saturated fats. I would stick more with polyunsaturated and monounsaturated fats. Next question. Does leaky gut affect COVID severity? Without question, it does. So the idea, 80% of your immune cells are in your gut. It's where your macro and micronutrients are absorbed. We know that the virus gets shedded out of your body. You know, COVID-19 is a virus, as we all know, gets shedded out of your body through the gut, through poop. So there's an emerging idea that many patients with severe COVID-19 actually have altered gut microbiota and associated leaky gut. There's no doubt about it. January 11th, Gut Magazine or Gut Periodical really talked about it and really spoke to the idea of dysbiosis and damage in the gut lining. So the theory is altered gut microbiota and a leaky gut may act as a crucial effector on COVID-19 severity. So much so that everybody may want to consider, if you will, getting a gut test, a stool test, a gut permeability test. Next question, let's see. What's the difference between laser and LED in effectiveness? So everybody knows I'm a laser guy. So in that, it's the number one question that I'm asked. What's different between the two? And it's interesting in that there's vast differences. Light emitting diodes, LED, are about 7% as effective in comparison to low-level laser therapy. So laser and LED have some delivery fundamental differences. The laser is what we call monochromatic. It's actually one wavelength, whereas the LED is multiple wavelengths. So the typical wavelength, like a red light, is the 635 nanometer. It has, the laser, a coherent light. It has the same frequency and wave, and it's in phase. So it's like this perfect red wave that you can always replicate. Whereas the LED doesn't have the same narrow band of light. Laser is typically collimated, so light rays are parallel and travel without divergence or spreading, whereas an LED is not collimated. So the takeaways, if I may, are the properties that determine the effectiveness of low-level laser in a biological system cannot be achieved by other light sources. The light from a 635 nanometer laser is dramatically more effective for producing photochemical effects than a 635 LED. Now, what's most interesting is, in many instances, LEDs have been used as what we call the placebo or the control because they're just not that effective. So if you're in the laser business or you're looking for a laser, please look for a low-level laser, a true laser, laser diode. Don't look for an LED. Let's see the next one. Why do they call COVID-19 a novel virus? Well, I've always said that it was a novel virus because it's a triple spike. But the real reason is it's the first virus known to mankind that actually has some asymptomatic carrying. As a matter of fact, more than 50%, as recently I read, of the people who have contracted COVID-19 are asymptomatic. So this is novel. This is breakthrough. So everybody's got to realize that when they say, I'm okay, I'm probably going to be asymptomatic. That may be true because this virus is an evil guy. That virus understands that you have a good immune system and it can attack you. But it finds you a wonderful host and it knows that you're going to go out into the public, if you will, and spread it. Whereas, like my mom was much older, a little heavy, blood sugar is a little high, bad host. When it attacks it, it has that option of, she's not in contact with that many people, and not in her instance, thank God, but in many instances, people died because of they were susceptible and vulnerable. So what you're looking for in its novelty is that it's the first virus, huge takeaway, that is asymptomatic. So those who tell me, I'm not worried about it, I'm good, you may be good, but you may be a carrier for other people. So it's something to consider. Please share some takeaways of magnesium Lthrenade. Magnesium Lthrenade is very interesting in that it is my choice for the form of magnesium for the brain. So there's 3 or 4 different types of magnesiums that I recommend. So a magnesium citrate is a great choice if you wanted to give it to someone over 800 milligrams to cure constipation. It'll turn them into secretariat real fast. So it'll cure the constipation. Magnesium bisglycinate is great if you just want magnesium in the body, and you can take a large number of it because it's a bisglycinate. It's attached to amino acids, so it won't have any gastrointestinal upset. If you use bisglycinate, magnesium Lthrenade is its secret source for the brain. It was studied and published in September of 2016. Magnesium Lthrenade actually drives magnesium into the cerebral spinal fluid and then into the neurons in the brain. It leads to multiple changes, including an enhanced synaptic density and plasticity. These were all supported by human studies. Other forms of magnesium did not have the same impact on the brain and the cerebral spinal fluid that magnesium Lthrenade. In reference to Alzheimer's in the brain, it prevents the loss of synapses and a decline of memory. As a matter of fact, it slows brain aging by 9 to 14 years. It also was shown to help prevent and clear the accumulation of toxic beta amyloid plaques. Those are the plaques that you see so commonly in Alzheimer's. And it also, the end result was the supplementation of magnesium Lthrenade suppressed the expression of the enzyme responsible for amyloid deposits by up to 80%. So the takeaways are very simple. Magnesium Lthrenade increases learning ability, working memory, short and long-term memory, increased synaptic density of brain cells, and reduced stress. So one article journal in 2016, it was the Journal of Alzheimer's Disease, that spoke about magnesium Lthrenade on cognitive ability. The effects were as follows. Number 1, effective at improving overall cognitive ability. 2, improved executive function. And 3, decreased stress and anxiety. So the conclusion was that study really highlighted the importance of increased neurons and its ability to help with neurons. So I'm just waiting for some newer questions because I think I'm very happy to answer any of them. Got another one here that they had sent in. Concussion, one of my favorite things to talk about. Does concussion have an effect on dementia? So concussion, interestingly enough, comes from when the head whips back and forth, and it's not necessarily the impact of the brain. Incidentally, the brain is only 3 pounds. The brain is made of a gelatinous form. It is not hard. I think I have it right here. Yeah, excuse me 1 second. Here's my brain model. It does not look like this. It does not look, it's soft. It's made like jello. So it whips back and forth. It's able to tear. Much more commonly in women than men, your brain. The damage is usually done in the axon region, which are like your electrical cords, if you will, in your brain. So you want to avoid that. So the impact is not as great. Women are more susceptible than men. Women are more susceptible because for one reason, their neck muscles are weaker and they whip back and forth even more. So let's get into the question about concussion's effect on dementia. Well, interesting. Head injury up the dementia risk by about 25%. A history of 2 or more head injuries are associated with more than 2 times the risk of developing dementia 25 years later. 10% of all dementia cases in the study related to the history of the head injury was after the age of 55. Women, once again, are more likely to develop dementia following a head injury. So obviously we want to try to avoid concussions, and obviously women have to be more susceptible. Number 1 concussion athlete, that concussion athlete is a female soccer player. And really great question. Does concussion have an effect on overall health? So 1, it has damage to things in your brain. We know that. Number 2, whatever you do to your brain, you do to your gut. Whatever you do to your gut, you do to your brain. So if you hit your head, you damage your gut. You're going to have a higher incidence of leaky gut, and all that comes with the leaky gut. So having said all that, in multiple studies, here's what they found. Concussion was linked to both short and long-term risk for overall health. People who had a concussion had an increased risk for poor health like diabetes, hypertension, cardiovascular disease, depression, stroke, even epilepsy, immune functions, and obviously leaky gut. Hey, Mark, how are you? Hey, Doc, what do you think of vitamin D3 supplementation by itself? Should it always be paired with K2? So we're going to take that. I don't like D3 on its own. I only want it with K2. So D3 we know should be called hormone. It's our sunshine vitamin. More so than that, the D3 needs to be taken for the K2. Without the K2, if anybody's prescribing that or taking it without K2, you have a susceptibility to plaquing in your blood vessels. More so than that, you want the K2 because the K2 has this panacea of good properties. D3, K2, 5,000 IUs of D3 with about 60 micrograms of K2. I'm going to continue with what Mark asked. He's been told that if he eats enough vegetables, he wouldn't need K2. Well, that may be true, and I think vegetables have a lot of K2, and please eat your vegetables, clean them, make sure they're organic. Without question, green leafy vegetables are a great choice, but you're still going to need the combination in the formulation between D3 and K2. If the next part of the question, if you can high dose with D3, but you can high dose, it's blended with K2, are there any dangerous effects? No, because you're really not going that high in K2. It's a minimal amount. It's just used as a what I call a compass in everything. Hey, Mark, my pleasure. Thanks a lot. How do we test for concussion degradation? And is there such thing? May have a concussion when I was around 18. So interesting that they're using state tests now to start the athletes off and then later. So there are some great tests that you can do. You can do some memory tests. For me, the blood tests are very indicative to see the type of damage that you could have for concussion. You would want to look at the blood-brain barrier. You'd want to test and see if you had amyloid or tau. You would want to also see if you have an increase in interleukin, C-reactive protein, and other inflammatory markers. So there are, without question, composite blood tests that you can use to test if your brain is damaged. The big problem is when you hit your head, you don't need a concussion to have all the deleterious effect from the head impact. So I'm going to try and do some more Q&As. It seems to work. If you have any questions, if you see this, whether it just when we get off, whether it's live or whether it's Memorex, if you will, please feel free to ask a question. We'll try and do a question and answer almost every week. It's been my pleasure. Everybody have a great day. Dr. Rob, always yours in health.